you can't survive without hope.
Wow.
So I feel like in this health journey that nobody should have to walk this journey alone. And I see myself as an educated educator that comes alongside and walks with them. And I almost always reassure my patients, we're going to do this together. And that's that component of where you're not alone.
Hi, I'm Haylie Pomroy, the Assistant Director of the Integrative Medicine Program at the Institute for Neuro-Immune Medicine. Today, I am also your host for the Hope and Help for Fatigue and Chronic Illness podcast. Today, I have a very special guest. She is one of our exceptional practitioners here at the clinic. It is Denise Kruszynski. Denise is a board-certified family nurse practitioner. She's also certified in functional medicine. We're going to talk a lot about that today. She brings a lot to the table in our clinic. She was a level 1 trauma center nurse, a critical care registered nurse for over 25 years. Thank you so much, Denise, for being with us today.
I am so excited to share what we have here.
We have a lot to talk about, so I'm going to jump right in. The first thing I want to talk about is what brought you to the Institute for Neuro-Immune Medicine?
Originally, I was brought to the Institute for Neuro-Immune Medicine because I was hired for the Veterans Access Clinic and because they were looking for another nurse practitioner for the Institute for Neuro-Immune Medicine, and they knew that I was interested in functional medicine. They snatched me up, and I am so excited they did. They introduced me to chronic fatigue, fibromyalgia, toxic exposures, and ultimately where we are now with the long COVID. So it's been a journey.
It's been a journey for sure. And I want to talk about kind of the dynamics of our institute. So you're in the clinical practice there. You're in clinical practice there. And can you talk to us a little bit about what types of patients we see in the clinic?
We see patients with an incredible array of mysterious illnesses. They come to us because they don't know what's wrong with them. They don't know what happened to them, and they want us to figure out. We play detective. So they come with chronic fatigue, fibromyalgia, but those are really labeling symptoms. That's not telling us what's wrong. So they come to us with a bunch of labels, and what we try to figure out is dig in and say, well, why do you have chronic fatigue? Why do you have muscle pain? Why do you have shortness of breath? Whatever. We ask why.
That's great. So when you bring that up, it right away makes me want to jump a little bit into one of the specialties that you've focused on, and that's functional medicine. So there's been a lot of talk about functional medicine. Can you give, like all of us out here, an idea of what is functional medicine, and then also why you're very accomplished, extremely busy. Why did you continue your education in your career in that direction? So first, just let us know, what is functional medicine?
Functional medicine is essentially systems biology. We look at all of the systems, understanding that all the systems are integrated, that there's not a silo for your gut and a silo for your brain and a silo for your energy. It's all integrated. So functional medicine is something that recognizes the integration of all of these systems biology. And then we dig into the root cause, which is why we ask why. And by the time we ask why 3 or 4 times, we're really getting down to the meat of the problem. So
at the Institute, we have a CLIA lab, exceptional labs. We have immunology, neurology, environmental medicine. We desperately felt the need to incorporate more. And specifically, you have continued your education in what there's called functional medicine. What was the precipice? What inspired or motivated you to do that?
Osteopathic medicine is a medicine that is more of I want to say a natural medicine. We deal with things that have to do with nutrition and with movement and with sleep and the things that make everyone healthy.
Real medicine.
Real medicine. Yeah. It's real health. So, and I didn't feel like I was well equipped with coming from an allopathic background. I didn't feel like I was well equipped to really deal with the complexity of the illnesses that we were encountering here. So functional medicine was something that was just the natural course that I needed really to take to be the practitioner that I wanted to be.
That's great.
Come alongside my patients.
That's great. Yeah, so I think the complexity of chronic disease and inflammation was kind of an inspiration for all of us to push harder to find solutions for the patients that come through our doors. Can you give us a little bit of color on what kinds of symptoms people present with? What types of things are they coming to the table with that maybe fall under, I don't want to say the word, but I a lot of times we talk about mystery illness or mystery cause. What types of things are they seeing or experiencing or feeling?
Very nondescript. They'll say, I feel tired, or I don't feel well, or I used to be able to walk or run, or I used to be able to think for longer periods. Just it's sometimes super nondescript. They can't really put their finger on it. They know something's wrong, but they don't really know what's wrong. I constantly have a cold. I have a runny nose. I have skin rashes. Just very kind of nebulous. What's wrong? We don't know what's wrong, but we're going to dig in and we're going to peel the onion and we're going to figure out layer by layer what's going on.
Do you find with some of our population that there's, I know there's a variety of components, but do you find environmental components ever?
Environmental, there's almost never just one thing that people get sick from.
Okay.
They're layers.
Okay.
Maybe it's environment. Maybe it's something they grew up with. Maybe it's the food that they're eating. Maybe the habits they have. It's never one thing. Maybe it's their genetics.
And so we look at all of that.
So we look at all of it.
Do you find that, like, I'm going to jump forward here for a second. Have you seen in clinic an increase in clients dealing with COVID long hauler?
There have been a lot of people who coming in, they had COVID and they just never got back to who they were before.
And what are we seeing in those clients?
There's fatigue, there's dysautonomia, they can't stand up as long as they used to.
I'm going to stop you for 2 seconds. I loved what you just said. What is dysautonomia? Pencils and crayons for me. That's what I always say, pencils and crayons. I always feel like if I can understand it, then our community can understand it.
So your autonomic nervous system is what does all the internal workings of your body. It's your blood pressure, it's your sweating, it's how often you urinate. It may affect your vision. Your autonomic nervous system is all that internal working that you don't have to think about, that it just works, or it doesn't.
And so with COVID long hauler, you're seeing people that are having a hard time regulating these types of things?
They're having a hard time regulating, and we kind of suspect that it's probably an energy deficit at the mitochondrial level.
Ooh.
So what we're looking at is when people come in with this dysautonomia, the number one thing that we're going to try to find out if there's something that we can remove, a toxic exposure that we can remove. But at the same time, what we're trying to do is we're trying to bolster them and strengthen them at the mitochondrial level.
Okay.
With nutrients, with lifestyle, with learning to conserve energy. We call it our pacing. And in that way, move them in the direction that they need to go. And at the same time, there's a little bit of trauma to having had of COVID and having long haul, because you wonder where the person that you are, where did it go?
I just love that you just said that, because I was just pulling up my notes, and what was coming into my mind was you have had over 25 years of experience as a trauma center practitioner. And do you feel like you're seeing some of the trainings or the experience that you've had now be applied during this time?
I think that the trauma, it wasn't just trauma, it was trauma ICU, medical, surgical, neuro ICU. What I see when I look at patients, I don't see the patient today. I can anticipate what's going to happen downstream if we don't make a correction.
So if there's not an intervention?
There needs to be an intervention. And when I look at people, I'm not really looking at how you are now. I'm looking downstream and I'm thinking, if we can tweak these areas nutritionally, if you're getting enough sleep, if you move your psychosocial dimension in the right direction, we tend to ignore that, but very super important for our core health.
Absolutely.
Is psychosocial, our relationships, our spiritual practices. Those things need to come into alignment. But then downstream, I can see, I feel this sense of urgency because I see downstream what happens when people push themselves too hard.
And they don't get the support or the care or
they lose hope.
Yeah, they lose hope.
you can't survive without hope.
Wow.
So I feel like in this health journey that nobody should have to walk this journey alone. And I see myself as an educated educator that comes alongside and walks with them. And I almost always reassure my patients, we're going to do this together. And that's that component of where you're not alone.
Right. I love what you said about 4 things just gave me the chills, actually. One is the educated educator. And I watch you constantly striving to bring more data to the team when we do our clinicals and we collaborate, as well as outwardly seeking more data for yourself. For yourself, but really the motivations for your patients. So that's incredible and amazing. And it leads me to the question, the other piece that you just said was giving the patient or the person out here the ability to lean into hope and how important that is. And we talk a lot about people not having access to the clinic. We do have people that fly in, we're booked to full capacity, but what do we do for these people out here that have limited access? How can we help them hold on to hope?
There's so much that we can do on our own. We can choose good foods to eat. That's the number one thing, because the patients that come, some of them don't have very much money. So if I can kind of guide them into that nutritional path, which we don't have tons of time to do that, but nutrition is really the core. If I can guide them to self-care, sleeping, everyone can do that for themselves if they're just aware of how vital that is. And that's what people out there who don't have access to a clinic like ours, they can eat healthy foods. They can try to eat organic. They can avoid processed foods, avoid GMO foods.
I just want to underline, highlight, and put a big exclamation on how important what you just said. So I think sometimes these things that you're right, we can implement at home. I think we're not always instructed by our practitioners at how critical and how vital it is. And I love that you punctuated that, because it is and we're here to give great direction on those types of things, on pacing and sleep. We teach classes on those types of things, and food prescriptions and food ideas. But I think coming from your experience, for you to say, this is a front line.
It's called lifestyle medicine.
Lifestyle medicine, frontline care. I love it.
Functional medicine, really, if you would want to call it one thing, it's lifestyle medicine. That's the core. That's the heart of the healing. Is the lifestyle medicine.
And it's hard to get well, let alone stay well, right? When our environment is conducive to not being well. And that brings me to my next question is, like, we understand that chronic fatigue, chronic illness, MACSF, COVID long hauler is a whole body illness. And so it's not that just, like you said, systems, the lungs, the heart, the GI tract. What are some improvements that you apply to your patients that you want our community to think about? So we've talked about food, sleep, and stress, okay? When we're looking at the whole body and you're looking at it from promoting wellness, is there something that you see, like typical diagnostics that you run? Like, make sure you run these labs. Make sure that you're talking to your doctor about this. Walk into the visit with a list of symptoms. What do you love to see come in through the door that can make the biggest impact with your patients? First, let me ask you this question. Sorry. How much time do you spend with your patients?
A couple hours. Our first visits are a couple of solid hours of talking and trying to dig into things. People don't realize what's making them sick. There was a woman, one story, there was a woman who had lead poisoning. What's wrong? We don't know. I have no exposure to lead. Long story short, it turns out she had a tea kettle. She would never empty the water from the tea kettle when she would make herself a cup of tea. She would just keep pouring water in it, and the metal was concentrating in that.
Oh, wow.
Just such a little thing, and it takes time to tease that kind of information out. Another person came in, what's wrong with me? Well, what were you doing in 2008 when you last felt well? Well, that was when the market crashed. And I am a realtor, so I was spraying glyphosate all over my empty rental homes.
Oh.
So, but people don't really realize that some of the things that they're doing.
So I think you just gave So I think you just gave us all permission to. Most people don't have that access to their physician for 2 hours. Sometimes not even in a month or in a lifetime. But if they come in and they're very organized and they have all of their data up front, that can be very helpful, right? And also, I think giving permission to communicate with their physician, all the little nuances that you might not think necessarily correlate with diabetes or necessarily correlate with the blood pressure being unable to regulate the blood pressure or things of that nature. So it's what I hear you giving us is permission to talk about ourselves.
And write it down. When you walk into a doctor's office, when you walk into our office, we have some targeted things that we're looking for. If you have things written down, if you're organized, if you come in and you say, I have this, and this symptoms, it's a lot easier for you to organize yourself when you walk in with that. Because sometimes people come in and they talk so much because they are so unused to being heard. They're not organized and their thinking is scrambled because they're just trying to spit it out really quick before I cut this visit short.
Well, no, that's important. I think what you just said is super important because I do think we feel pressured. I do, going into a physician's office. But on the other end of that, you're saying that even in a 2 hour, even if we had 2 hours with our physician, it would be so beneficial to be able to help them. You can help them faster if they're organized walking in the door.
If they're organized according to systems. If you have this and this and this and this is wrong with my sinuses, with my gut, with my heart, that's pie in the sky, really, I think.
No, I love it. I love it. Dream big.
But that would help. That would help. It would help to have recent lab work. You walk in with your recent lab work. You walk in and you think about, have I ever lived in the country? Was there crop dusting going on? Have I lived near a golf course? Have I lived near a marina? Does my house have mold?
Brings me to a couple. I want to talk about another aspect of care that you bring to the table and you have experience, because I think we're hinting to it a little bit, but you've done some what they call FQHA or federally qualified healthcare clinic work. You worked with the homeless in Key West and also Native American tribes as well. Can you tell us what you learned a little bit, both from environmental medicine, from functional medicine, exposure medicine, with both of those populations?
I think the biggest thing that I learned in Key West is that people need their family. People go to Key West to get away from the stressors of life. Meantime, they leave their family, they leave everything behind, and they come to Key West, and they are completely, after a year or so, Key West is a really fun place to live. The locals are amazing. But after a couple of years of that, they're lost, and they don't have a reason for living because now they've pursued everything that's fun. It's not fun anymore without your family, without your relationships. So probably that's the biggest thing that I learned in Key West is that family's important.
And so isolation can be a real detriment to your health. So as we give pearls of wisdom, as we engage, is people being involved in some sort of a community, family, loved ones, volunteer groups, things of that nature.
And they're a lot of work. Family, relationships, but it's worth it. It brings such dividends back to you, even as you put forth, that effort and that sacrifice. But there's dividends that you can't have when you're sitting alone in your room doing, or even walking around on a beach. It's just not enough. And then in Oregon, in Siletz, where I worked with this tribe, I learned what generational trauma, the impact of generational trauma on culture and on individuals. When you strip individuals of who they are culturally, you also kind of gut their well-being and self-esteem.
I promise me we'll have a podcast just on that. I know it's very profound. I think it's very profound, and I think that it is something that sometimes we forego when we're looking at taking illness into wellness.
Yeah.
Right?
Yeah. When you look at cultures and it's very easy to stand back and criticize whatever culture. You could pick any little subculture that we have in the United States and we can say, oh, they should know better. But they don't, because they're dealing with this multi-generational trauma. It's not just the Indians. We could pick out several different populations in the United States and I'm sure around the world where there's multi-generational trauma. Generation for generation has suffered, and that.
And it crosses
impacts
cultures.
people.
Yeah, absolutely. Okay, I'm going to throw you a curveball here. What do you feel sets INIM apart from other institutions? So not just our specialty clinic, which is incredible and amazing, but what do you think sets this institution apart?
We have this incredible mind meld that occurs every week in our clinic.
I just got chills. Yeah.
So when someone comes to see me, they're seeing the tip of the iceberg. They're coming to see me. I'm gathering information. I have a lot of information. But then there are always these unknowns. And I take it to our clinical meetings. And then I have people that are world-renowned researchers, widely published experts that are quoted and cited in papers all over the world. And I get to ask these questions. And we get to present our patients to each other. And when you have this conglomerate of amazing minds coming together with decades, over 100, maybe 150 years of experience or more than that, all in one room, and we have a tremendous gift to our patients because they have the benefit of all of these other physicians and experts that they'll never see.
Right. And I know that we can't show everybody that, but it would be so exciting at some point because I think we were calculating over 200 years of clinical experience. And people,
that's what I was thinking.
Yeah.
It has to be more than 100.
I know, it's just amazing. And people had these amazing titles like the number one world in the world, not just the United States, on mast cell research, number one in ME/CSF research, COVID long hauler studies going on, work with GWI and veterans. I mean, we have these people that are coming in and like I said, you are definitely a standout in asking questions and pushing forward your clients' cases, which I love to see because you're just such a good advocate for them.
It's a gift. It's a gift to me as well as my patients.
It's fun times.
Yeah.
We love our Fridays. Okay, now I'm going to pull out my magic wand. So in the forefront of medicine, in cutting edge medicine right now, if you were to say, so we do a lot of translational research at the Institute where we're taking things that are in phase 1 trials, concepts in medicine, and we're able to, because we're a research clinic, implement a lot of these things right into our patient population, which is also extremely special. Yes. But time is always of an issue. Time and money, just time and money. What, if I had a magic wand, would you love to see available and accessible to our patients tomorrow that you see on the forefront, but it's not getting to us fast enough? And I feel this so much in the long hauler space, maybe because we're seeing so much of that, but.
Hyperbaric therapy.
Ooh, hyperbaric therapy. Okay.
Maybe some red light therapy would be amazing.
That's wonderful. And can you give me a little bit of with the hyperbaric oxygen chambers, HBOT, hyperbaric therapy, how would you love to see that implemented? I don't mean technically 2 times a week for 28 minutes, but you would love to see that implemented for our patients as part of a therapy?
Absolutely. I had a woman who came in who was having some issues with her vision, and she had a friend who had a hyperbaric chamber who allowed her to use that hyperbaric chamber for a very discounted price. And she said she noticed after every visit, she would notice her vision was a little better, it would stay good for a few days, and then it would go back. But after repeated therapies, she had chronic fatigue.
Right.
Her sister had to move in with her. Her vision was bad, cognitive decline. She had the whole ball from COVID. She was amazing. She went back to work, still part-time, but she went back to work, no more visual problems, mental clarity returned, just tremendous turnaround. Came to me very, very happy. And thankfully, she doesn't need to see me anymore.
That's great.
Because she's all better.
That's great. Yeah, that's great. We had that experience with my grandmother and hyperbaric chamber post-stroke. It was remarkable for her. And it was, again, similar. We had to go out, private use of it, but it sure would be nice to see that accessible to patients in clinic. That's a big wish on all of our lists right now. Is there another type of medicine? So we're currently right now we're doing research on N-acetylcysteine with neuroinflammatory. So would you like to see more research in the supplement space?
I would love to be able to do some infusions.
IV infusions, yes. Ooh, I love that.
That's what I would love to see. I would love to see some infusions. I would love to see and I wish I could tell you the name of it. There are some therapies where they do plasma exchange and they're able to extract viruses.
Absolutely.
I would love for us to be able to do some of those.
In clinic, yes.
Yes.
Yeah, we just had a client that just had that done inpatient, right? And it would be nice if we could do that in the clinic. That would be amazing. And there's some so with that, you brought two things up. Infusions, do you feel like a lot of people that are dealing with inflammatory disorders in general have lack of gut absorption, so the infusions can bypass some of that?
First of all, depending on the type of infusion. Some infusions can extract viruses. They use this for Lyme, for Epstein-Barr, and some infusions can instill nutrients like glutathione, like NAD, I guess N-acetylcysteine. Did they do that infusion? Oral. Okay.
Yeah. But that's a great option for people for sure. I would love to see that accessible everywhere. I mean, I know that people are going out and doing private pay on a lot of those things, but we need to integrate those in. This is amazing. So whenever I have the opportunity to interview somebody like yourself, I always call it fear of missing out. I get to spend Fridays with you. We get to spend some other time together as well. But I know everybody out here is wanting some pearls of wisdom. So when a person finds themselves battling with a chronic disease or chronic fatigue or inflammation, how can we help them hold on to hope and find some resources? Are there some resources that you love to send people to, whether it's support or in the functional medicine space?
I always point people towards nutrition.
I love it. Oh my, I promise I didn't prompt that.
If you can do nothing else, eat foods that are organic, eat meats that are grass-finished, not grass-fed.
Not just grass-fed. Thank you. No, thank you.
Eat eggs from free-roaming birds, free-roaming chicken. Anything that's fed corn is going to be more highly inflammatory. You're going to have a higher omega-6 to omega-3 ratio. You want to avoid that.
I'm going to stop you for 2 seconds because what you said is remarkable in the food space. So many people are concerned about omega-6s with beef, right, or pork. I think they miss the fact that eggs that come from animals that are fed high corn diets are so pro-inflammatory, pro-inflammatory. And they think they're ovalactin, they're only eating maybe eggs or pescatarian ovalactin, and they can't figure it out. And then we run our lipid panels, our unique lipid panels, and we find that those, that's a big one. Corn is good for, fattening up beef.
Exactly. And if you think of the things that are pro-inflammatory, dairy, corn, and eggs, those cows are fed corn.
Yes.
So of course they're inflammatory, and chickens are fed corn.
Yes.
And of course they're pro-inflammatory. So depending on you are what your animals eat.
Yes. You're just not what you eat. Yes.
Right.
But you're also what your soil eats. I tell this to my vegan and my vegetarians too.
Yes.
Yes. We are feeding the soil. We are feeding the plant. It is feeding you.
And if you are tossing a bunch of pesticides on a plant, you have to ask yourself, why do you have to toss pesticides on a plant? Well, because you have so weakened that plant with herbicides that it's no longer able to chelate minerals out of the soil. So if you can't chelate the minerals out of the soil, then the plant can't protect itself. So you have an altogether weakened plant. You're eating a very nutrient deficient plant when you're eating a plant that has been had herbicides spread around or has been sprayed with pesticides.
I love that. And these are very, very empowering suggestions, and they're empowering, in my opinion, because you've given us knowledge behind them. I love to know the why. I'm going to just pull it full circle here. This is why, right? We incorporate aspects of functional and integrative medicine with neuroimmunology so that we can understand the why you're sick and work towards giving you hope and help to get back on your health journey. Yeah. Awesome. Denise, thank you so much for being here today. I always learn so much from you, and I always appreciate our time together. But I have a lot of joy because everybody else is going to get to share what I get to share. And so I know it's going to be important for our community. Thank you so much.
So good to be here. Thank you for having me.
Absolutely.